So I'll be speaking on exosomes, the science and the mechanism behind the exosomes. So I'll be dealing these salient points in my talk. So what are exosomes? So exosomes are extracellular vesicles that helps in cell-to-cell communication. They have 30 to 150 micron nanometer diameter. They are encapsulated in a lipid bilayer. Their cargo contains mixture of several growth factors, peptides, lipids, proteins, microRNAs, and signaling molecules. So, bit of history of exosomes. In 1940, the scientists were able to identify some molecules. It took nearly 40 years to name that particle as exosomes, and another 20 years to see the action, and then still another 20 years, that in 2020, they were used to deliver targeted therapy. Now, how do exosome works? So, exosomes are nano-sized, so their uptake by recipient cells can occur through endocytosis, phagocytosis, or fusion with the plasma membrane. The exosome cargo content is released into the recipient cell cytoplasm. You can see in this picture it's how it works. The particle adhere to the surface, they release their proteins into the cytoplasm, and then it gives signal to the cell to function. So role of exosome is in mediator of cellular communication. It regulates cellular behavior, stimulation of cell growth and proliferation. It triggers angiogenesis. It has anti-inflammatory and immunomodulation effect, and transports protein, lipids, and nucleic acid to the target cells. The source of exosomes are the stem cells, which can be derived from the plant, animals, adipose tissue, bone marrow, umbilical cord. Now, plant cell-derived exosomes, are they really working? Let's delve into it. We get less number of proteins and their levels, no membrane transporters. They're enriched only in one type of microRNA, less effective in cell-to-cell communication, low anti-inflammatory activity, and ceramides, sphingomyelin that helps to moisturize and protect the skin are absent in plant exosomes. So in one word, plant exosomes are meant for plants only. And so do the animals' stem cells, or the exosomes are meant for animals only. Now, why we choose umbilical cord, mesenchymal stem cells derived exosomes? Now, bit of science. What is parabiosis? It is a study of transforming aging cells to a younger cells. There are a lot of studies there. If you transfer the plasma present in the younger cell to an older cell, it has been seen that the older cells start behaving like a younger cell. And vis a vis, when you again transfer the plasma from the younger cell to an older cell to a younger cell, the reverse happens. Now, let's compare the sources of exosomes. So we must know what is the source of stem cells from where we are getting the exosomes. Now, once we are born, the stem cells are in embryo. After birth, it is in bone marrow, fat, dental pulp, and the hair follicle. And in utero, it's in embryo, amniotic fluid, and once afterwards, it's in umbilical cord. So in adipose-derived mesenchymal stem cells, there are no ethical issues. The risk is minimal. But the exosomes we get only of the mature type. And the obtained quantity per batch is limited. But there will be a maximum variation of the type of exosomes we get from the adipose tissue. Coming to the amniotic fluid cells, there is a problem, there is an ethical issue. And not everyone will agree for amniocentesis because of the risk of infection and abortion. Though we get embryonic-like stem cells, but the quantity is small, and there will be maximum variation. And while in bone marrow-derived stem cells, there is no ethical issue, but the risk is definitely minimal. What we get in hematopoietic cells, we get 90% of the hematopoietic type only. Only 10% we have mesenchymal stem cells. So the yield will be less. But again, there will be maximum variation. But from the umbilical cord derived stem cells, there is a plenty, there is a no risk to the mother, no risk to the baby. There are no ethical issues. Risk is minimal, and we get day zero stem cells. So, and when we can harvest large amount of exosomes, and there will be minimal variation. Let me explain you this slide. If we are taking stem cells, from stem cells only we are getting the exosomes. If we are taking from the embryo, so the embryo is totipotent. Totipotent means it is the capacity to differentiate continuously, endlessly, until and unless the full organism is born like us. So theoretically, the exosome derived from this thing, embryo, there is a chance of teratogenicity, a cancer formation. Now coming to the environment in which the baby is there, that's the amniotic fluid. The amniotic fluid stem cells, they are pluripotent. That means they again can differentiate into all three types. But their capacity, the exosomes or the stems, exosomes derived from the amniotic fluid will keep on differentiating into all three layers, not to the totipotent level, but to be maybe an organ formation. So there can be a chance of again cancer formation is there. Then third generation, that means when the baby is born, the umbilical cord. The umbilical cord, you know, 4 to 6 feet length is their umbilical cord. So we have ample amount of stem cells from it. So whatever the exosomes will come from that batch will be behaving all same type. Their size, their characteristic will be same. And taking umbilical, taking exosomes from the adipocytes, there is a limitation to it, because healthy person maybe between 20 or 35, from that only a limited amount of liposuction can be done because of their voluntary donation, and then you harvest it. But these exosomes will be of adult type only. But if you are looking for exosomes which will be having a good response in each and every tissue, then the day zero exosomes will be the best. Now, considering the exosomes, their quality, we must know how it is being manufactured. So we must know the source, its purification, and then its application. Now, how we do a nanoparticle anti-analysis. The total number of nanopeptides is around 0.05 mg per solution, which contains approximately 6.45 billion particles per ml in the exosomes. So total exosomes, which are of size between 30 to 150 nanometers, we get approximately 5.59 billion particles per cell. And to know protein estimation, we do in-house BCA protein assay, which yields 1.73 milligram per ml of exosomes. And zeta potential assay is done in order to know the stability of the exosomes. So the mean zeta potential of exosome is around 15.61 millivolt. And with flow cytometer, we come to know really whether there are exosomes or not. So the particles which are exhibiting CD9, CD63 and CD81 markers in a population of more than 60%, we consider those batch as exosomes for an therapeutic use only. MTT assay is done to know whether the exosomes are cytotoxic or not. It has been shown that exosomes are not cytotoxic. So again, they are easily permeable to the skin. The quick and easy movement is across the membrane. The permeation profile of the drug product shows nearly 1.74 plus minus 0.25 centimeter per square centimeter when they applied on the skin surface. And that is the dose for the topical application which is recommended. Now, advanced exosome we have done anti-aging properties by checking hyaluronidase and tyrosinase inhibitory activity. I'm coming to the therapeutic dose. For skin, we use 5 billions, and for scalp and for the hair, we use 10 billions exosomes. So, regarding anti-aging, we see the collagenase inhibitory activity, and for antioxidant, we have seen that it is having nearly close to the ascorbic acid activity. So, how do exosome works? The instant biological effect starts from modulation of gene expression, protein synthesis, and signaling pathway. There are many studies, you can go through it and you can catch hold of the exosome Advancexo people. They can provide you all the literatures. Now, clinical application in wound healing, it enhances tissue regeneration and repair by suppressing inflammation. Wound healing on scratch test, enhanced tissue regeneration and repair by suppressing the inflammation. Anti-aging, it promotes collagen production, angiogenesis, and stimulates stem cell proliferation, leading to skin rejuvenation. Regarding anti-aging, it promotes collagen production, angiogenesis, same thing. Now in hair growth, it stimulates hair follicle cells and promote hair growth in anagen phase. Regarding pigment regulation, it regulates the melanin production pathway and activate melanocyte precursors to differentiate into mature melanocytes. So how to choose right exosomes? We must know the source, their assay, their stability, and obviously the flow cytometer showing the CD markers of 9, 81, and 63. Their protein estimation. There should not be any skin irritation and no photoallergic potential. Now for skin, what we do at a monthly interval, around 3 to 4 sessions. These are the some cases. I'm not going to detail of them. My next speaker is going to take. For hair, we again do a monthly interval. Topical application with micro needling is what is indicated. But in my practice, I do both. I inject on the skin as well as on the scalp without any problem. So in conclusion, exosome represents a promising tool in dermatological treatment. They offer a versatile platform for enhancing tissue regeneration, skin rejuvenation, and targeted therapy. Ongoing research and clinical trials are essential to fully understanding the potential and limitations. So at last, I invite you for Aesthetic Essential. It's an applied anatomy workshop in Singapore. You all are welcome. Thank you for patient listening.
That was Dr. Vikram Rathore, sir. Thank you so much, sir, for such an enlightening. Okay. Any questions, if anybody has, we can take it later. Now, I invite Dr. Gaurang Krishna, sir, for his presentation.
Good morning, everyone. So I'm Gaurang, and I'm a dermatologist turned a trichologist, and I just do a trichology practice and hair transplants now. So first of all, thank you very much to CDSI and Advanced Exosomes for organizing this workshop and giving me this opportunity to be in front of you. So most of the hard job has been done by Dr. Rathore, sir. So I'll be talking practical aspects of exosomes. So what exactly are exosomes we have seen? Now how it works in hair loss disorders, just consider this. So molecular pathways are basically WNT and beta-catenin pathways. But practically for us, what it is doing, it is accelerating the transition of telogen into anagen. That's the primary thing that it is doing. So reduced hair fall and better hair growth. Why it helps in androgenic alopecia, alopecia areata, etc. are because it also induces cell proliferation, which includes stem cell proliferation by the bulge area. So consider exosomes as something very similar to PRP, although chemically pathway of action is different. But what PRP does for us, what PRP has been doing for us over many years, exosomes does something very, very similar. And thus, wherever you feel that the patient is going to get benefited from PRP, those are the patients where you can use exosomes also. So where do I use exosomes in my practice? So all kind of patterned hair falls, male pattern, female pattern hair falls. I use it with my hair transplants, either pre, intra-op and post-op, both, all these three scenarios, we have felt that exosomes is giving us better results. We mix it with PRP. We use exosomes as monotherapy. Monotherapy as in only injectable is exosomes. And we also give patient to use at home, as Dr. Rathore said, that it's not just injection and microneedling, they can also be directly applied. And it has been shown that there is a significant percutaneous absorption also. So the versatility is very nice. Why it gels up so nicely with PRP is primarily because the set of growth factors that exosomes have, it's slightly exclusive of what PRP has. So if PRP has these growth factors, exosomes has these growth factors, and when they are combined together, the results are of course better. The only point of note here is that it should not be used as a monotherapy. Though see, in our aesthetic practice, both in dermat and in trichology, we keep getting new things. Every 2 years we get a new thing, which may or may not work. And sometimes by talks like these or by on social media, things are hyped a lot. So as doctors, we should know that these have certain limitations. These are not replacements of a standard DHT blockers, minoxidil, etc. These are adjuvants of it. So when we are, let's say, counseling a patient, or when we are posting our results on social media or academic workshops like these, we should not say results of exosomes or results of PRP. We are results of holistic treatment, and exosomes is a part of it. A naysayer would argue that, okay, show me results of monotherapy, and we won't be able to show results of monotherapy with exosomes. So think of it like a tug of war. In a team, there are a couple of very strong men, which is minoxidil and finasteride for us, but then there are so many weaker participants also who are not useless. They have their own role. They help the stronger ones in winning the battle, and that's where exosomes, PRP, microneedling, low-level laser therapy, all these things come. So these are certain results where we have used exosomes along with our standard treatment. And as we all know, the vertex area is usually a good responding area to non-surgical treatment. And again, in our practice, before hair transplant, we always try non-surgical treatment. And since we have added exosomes in the mix of things, we are seeing much better results. So that's all about the talk. We'll be discussing more on an in-person basis when we'll be demonstrating and doing the hands-on in patients. The hands-on will be doing both through microneedling and injectable, and we'll be taking your questions. Thank you so much.
And body hairs too, but his condition was that I should have hairs at least within 3 months time, because there was a social event. So what I did PRP means I to GFC. Same. GFC 2 weekly, then 2 weekly exosome. This is how I did, and 6 sessions. He was having at least the shininess of the scalp was gone, and what I noticed, there was a rapid growth also. Secondly, what I noticed, not all the transplanted hair shed.
Yes.
This was my observation. I did only in one case.
We have seen that, and that confirms the theory part also. Faster telogen to anagen transformation and less apoptosis. Because of these, we may see faster results after hair transplant when we use exosomes.
Thank you so
Does
much,
this
sir.
procedure, they don't increase fibrosis? Once you've done hair transplantation, what is the need of doing all these things?
To expedite the growth.
I think with every injectable treatment, you will increase fibrosis of the scalp. When we do retransplantation in a patient and who has gone through multiple PRP sessions, when we make slits, we know what is the condition of the scalp, totally fibrosed, and the results also not up to the mark of patients who have take some people or some hair transplant surgeons and all, 12 PRPs, 15 PRPs, like that, and when they come for the second, because it's an ongoing process, they will have to come for a second sitting also. At that time, the condition of the scalp, I feel, is pretty bad.
Very valid question, Dr. Presh. I'll say here, I will answer you. See, when you are injecting exosomes, it has an inherent capacity to heal, to renew, to replace, to regrow. So, with exosomes, the chances of fibrosis are not there. Because I am doing one study, I am using exosomes on hypertrophic scar and the keloid, and soon I'll come out with my observation.
So to answer your question, see, we have a lot of patients who have undergone multiple PRPs and they are undergoing hair transplant. So many times we do feel that the scalp is a bit thick, but that's primarily because of the higher thickness of the dermis rather than fibrosis. And I do not think that the results with a person who has got multiple PRPs or any, let's say multiple microneedling, the results do not vary. In fact, in scarring alopecias, we pre-treat the patients with PRP, microneedling, sometimes fractional CO2 lasers to improve the collagen, to reduce dermal atrophy, to reduce the scarring of the skin. However, when we are doing the second transplant, then of course the scalp is fibrosed because of the hair transplant, because the trauma that we are inflicting during a hair transplant is high and fibrosis almost. So if you biopsy a patient who has got a transplant done, some form of scarring will always come. So that is because of the needles or the blades that we have used. When we are injecting anything, PRP or whatever, exosomes, then if thin needle is used, a 31 gauge needle is used, no matter how many times it has been used, it does not increase the fibrosis potential. Now, a person who has undergone multiple treatments, whatever treatment it could be, and then ultimately landing for a hair transplant, you see, that's already a long-standing male pattern hair loss. And male pattern hair loss, peripheral fibrosis and skin fibrosis is a part of male pattern hair loss. So probably that's why in some patients we feel that while making the slits, the skin is much harder than, let's say, someone who is younger or maybe grade 3. So if we operate on grade 3 versus grade 6 patients, grade 6 patients usually have a thicker skin because their male pattern hair loss has been longer standing, the age is there. So yeah, probably, but we need to see it more carefully whether PRP alone or exosomes alone, any form of microneedling alone increases fibrosis or not.
Actually, it is more with mesotherapy. The cocktails which is in the market, people use mesotherapy. It's not that much with PRP though, and GFC, when you're using your own products. But it's much more than when cocktails are used. Mesotherapy.
Yeah, probably that's an interesting thing. It needs to be looked at. Probably some kind of inflammation is happening because of the products that we are using. Because you see, microneedling we are using for acne scars since ages, and we know that acne scars improve, the fibrosis improves. So if it is improving on the face, why it should increase it on the scalp?
I'll clarify. Let's go to basic pathology. I'll tell you. You must have noticed someone who has cut her hand or his hand with a blade or something glass, then you must have observed the scar. A surgeon has placed in precise incision, stitched up the thing, the behavior of that scar is different. Do you agree with this basic thing? Because there are two things. See, how trauma is being created on the surface of the skin is very important. We are doing microneedling or using insulin syringe which is very thin. Clear? It's not causing scar, it's causing micro puncture only. If you but if you scratch a long thing with a deeper and in a ragged way, then the amount of scarring is more. That means the fibrosis is more. And second thing, the definitely inherent capacity of the person's healing is also there. And thirdly is, we are using what chemical. In physiotherapy, we don't know what chemicals are there. Are they are really causing a pinpoint injury to the tissue where it is being delivered, or it is having a lateral and three-dimensional spread to the injury. So accordingly, the fibrosis will be there. And in PRP and in exosomes, we are injecting a chemical which is supposed to do organization, healing, renewal, regeneration, and not the fibrosis which is there with the I'll say uncontrolled trauma to this. I hope that settled down your answer also.
This discussion is going very nicely, and I'm liking that delegates are also interacting with you all. If anybody else has any questions, they can ask.
Do these exosomes go through various testings apart from in other diseases?
Yeah, so all manufacturers have their own way of producing. So one thing is source, how you identify the correct source. Then the isolation and culturing process, and then the filtration process. So this particular brand uses a thing called TFF, transitional flow cytometry, which is considered along with ultracentrifugation as one of the gold standards for purification process. So yes, they have to undergo very stringent. Even after production, they must test it for all kind of viral markers, because transmission of viral transmission is a very much possible thing. It's a very much legit thing with exosomes. So it has to be done in that way. So that is why wherever you are sourcing your exosomes from, all these things have to be read, talk to the people, and only then.
They are never to be injected. They are never to be injected.
Not really. It's nothing like that. So if we want to play like super safe, then microneedling. See, if any kind of infection has to happen, it can happen even with microneedling. So it's not like exosomes cannot be injected. Exosomes can be injected.
Why the FDA is
Because it's still early stages, and most of the diluent that they are giving are distilled water and L-ascorbic acid, which are too inflammatory. So they have seen a lot of, if you mix this diluent, which is there here, this cannot be injected, because then it will cause a lot of inflammation, even lymphadenopathy and things like that. But if you mix with saline that we use for toxins, it's fine.
Yesterday, I think one of the companies spoke about a machine, Rejuvenation. I can get the name now. So they've come out with a machine where you can, out from PRP, prepare the exosomes in your clinic, and then you can inject. That's the only one they say can be injected.
How does that?
That's basically in Alta your blood only, CFC, nothing else.
Yeah, so
See, exosome you cannot have this. See, each and every cell produces exosomes. Your epidermis, your keratinocyte, your melanocyte, because how the cells are talking to each other. They are talking to these extracellular vesicles, which is transmitting the communications. The nephrons are talking to nephrons. My Purkinje are talking to the Purkinje by these only. So different types of exosomes are there. So everyone is secreting. The RBCs are secreting, WBCs are secreting, platelets are secreting. Now if you come to the basics of the regenerative medicine, the basic is what the platelet, the growth factors which are present in the platelets. Either it could be directly injecting platelets, or you extract the growth factors which are present in the platelets, as in GFC. Clear? See, exosomes, there will be a way. You can't have this thing. And as I think you missed the basic thing. See, the source, what Krishna was saying, the source is most important. So, just for telling you, the basic source is the embryo. That is having the highest capacity to differentiate. So, the exosome derived from those stem cells will be of the best quality. They can regenerate anything. Anything is anything. Then we are made up of that only. Yeah. Then the environment, the amniotic fluid derived, they are pluripotent. Then the umbilical cord, they are multipotent. And then the unipotent, like the skin grows, like other thing, liver regenerates. So that's a unipotency potential. Okay. So we want to have something which will work as a magic, which can use in everything. We can use in bone, we can use in cartilage, we can use for hairs, we can use for the skin, we can use for the melanocytes, we can use for the adipocytes, we can use for regeneration of neurons also. My dear friend, the science is heading towards regenerative medicine. Earlier you board on that train.
Are you shown better result with the intraoperative exosome during air transplantation? Are you getting better result with giving intraoperative exosome during transplantation?
Too early to say, too early to comment on it. We've started doing it right now. But how it's going to transform the results, we need to wait for at least 1 year for that. And we have to have a big data, like at least 50-60 patients before we can comment on it, that yes, if we add exosomes, results are better. So it's too early to say that. Early findings, like sir is doing one patient, so he found it like the results are earlier, but that can happen even in a normal patient without any exosomes. So yes, there may be a, you know, there may be a faster result because of if we see the theoretical potential, but too early to say like clinically, you know, how well it is doing. But you know, we should try that for sure.
I want to add one thing. One more thing. What so I was telling you, the basic is the growth factors or the cytokines which are present in the platelets. The basic step of regenerative medicine, and the ultimate step is the stem cells only. Clear? But there is a problem in using stem cells. We are not, the USA FDA has not given guideline to use stem cells except for some blood dyscrasias, blood cancers, leukemias only. But you know, there are scientists who are lateral thinkers. They will not follow the rules. They are doing something. So in between, what we can have? We can have exosomes. So more immature or more early stage exosomes is there. The versatility of that exosomes in different clinical indications will be there.
You had mentioned that they are also helpful in wound healing. Like I came across one article that they said that when you do the suturing and you put exosomes, the healing and the scarring is very less. Healing is quite fast and scarring is quite less. So is there a role, or exosomes have a role to play in that?
What I definitely it is there. What I will say, we have to do, we as in clinicians, we do n number of things, n number of wound traumas. Sometimes we are creating, sometimes the already an existing trauma is there. You do tabulate, and I think we need, as you said, we need a long data.
So we have done this with PRP. So we have done in hair transplant patients FUE, half and half post-op PRP, you know, just after the procedure was completed. And we did see, and we have presented it in ISHR somewhere. So we did see better healing and, you know, lesser scarring on the PRP treated side. This was a sample size of 50 odd patients. So I think the same can happen with exosomes. So we are going to plan another study with only exosomes, half and half, donor site healing. Because results is going to take time. But donor site healing we can see in about 2 to 4 weeks, and we can comment on it. So we are going to start a study on that.
Also, sir, on the face, we can alternate it with skin boosters or
Yes, you can combine treatment with the exosomes also. Same sessions also you can do. Yeah.
so skin will not get confused if yeah,
Not skin is not going to get confused, to tell you truly, because I'll tell you then again, let's go delve into the very basics of exosomes. See, as I told you, they are the communicating molecules, how cells are interacting to cells, how they are giving message to the cell. Now you have to go apoptosis, now you have to divide, now you have to regenerate this and that, blah, 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 all those things. So, when exosomes means extragenously you are injecting or applying, creating microchannels and sending into whatever the things, they have the capacity to read the sick cells, because the sick cells are secreting some signals. So these signals are being picked up by the exosomes. They go there and they give information, deliver the cargo, and the function is being done.
Also regarding your question about malignant transformation, the potential of malignancy. So it's a legit concern. Initially when exosomes were being started, so apart from transmission of infections, malignancy was a very legit concern. So there were some exosomes which were adding natural killer T cells in their preparations to reduce that chance. And then the modern exosomes, they're testing it. They're making sure that there is no DNA material, there is no kind of antigenicity or genetic material when they are purifying their exosomes. So there are no to very, very less chances of malignant transformation.
So whichever exosomes now there is so many companies are coming up with it. So how do we, I mean, we have to ask them, obviously every company will say no, ours is the best. So
No, so
it's-
ask specific questions, very, very specific. So
So verbally, or we should ask for the papers also?
papers, always. No, verbally, so they'll say yes, yes, and yes.
Exactly.
So it has to be papers.
See, I'll tell you, the source is most important. Coming to the very basics. Totipotency means embryo. Pluripotency means amniotic fluid. Then multipotency, umbilical cord. Unipotency, when everything is there.
Which is the safest?
Safest is, I'll say, day 0, umbilical cord 1. Or you can use our own adipocyte derived. But you can't expect the same amount of result which a day 0 exosome is giving.
Umbilical cord.
Yeah.
So usually umbilical cord that they prefer is because they are young cells. Amniotic is better, but ethical issues in extracting amniotic fluid, big time. So that's why umbilical cord stem cells right now is the most preferred one. Adipose tissue derived is great, but they are mostly from adults, adipose tissue, bone marrow. So they are aged exosomes, so that's the main difference.
Do we have an adequate sample size of exosome therapy to substantiate that it is safer?
Safety wise, though, I think it has been substantiated already, both by the manufacturers of various and I think through FDA also they have they have given a label for the safety of exosome use. Efficacy, early stages, very early stages, because mostly there are preclinical studies or studies with very small sample sizes to say whether clinically how useful is this, and it's not FDA approved, of course, right now. None of the brands are FDA approved.
In India, do we have adequate sample size study?
No, I don't.
You become a part of this multi-center study.
Early stages, it's just coming up, just like PRP 10 years back, exosomes is right now at that stage.
So another thing, just one thing is, you said that it involves a series of steps, right?
Yeah.
Then how come this company they're coming out with a machine that you can do it in your clinic and
That's
it will
why I
be
told
ready
you
in 10
that
minutes?
no. It's only a pure growth factors which you are getting.
Okay.
Don't
There's
rely
no
on this
difference
anymore.
on.
So these exosomes are called intrasurgical exosomes. So just like when we take out fat and make emulsify it, that's
Correct.
intrasurgical stem cells, which is a very small number, very small number. So when professional companies make it, there is an elaborate way and they culture it. So they would not have 5
Multiplication.
billion or 10 billion exosomes when we are making it in the clinic. So and even when we are injecting autologous adipose derived stem cells, we can make it in the clinic, but the effect will be lesser because the stem cells are very less. But when we send it to a lab, they will culture it, make billions of stem cells. So results would be slightly better. Now that is a different argument. What are the results? Whatever they are.
See, we should know the science behind it, what you are saying. We should know what exactly we are doing.
Because yesterday it was very tempting, I mean, to see that, oh, you can make exosomes in your.
Ajay, I want to ask one thing. How many of you are doing Regenera and how many of you believe in Regenera?
Sir, I got it done once for my own husband. I did not see any result. So I just.
See, let me tell you. See, I hope everyone in this class is clear about the stem cells and the exosomes. Clear? Now coming,
I didn't attend the mixing. So
I'll take a personal
I'll
class,
take
don't
a-
worry. So now Regenera, what it is doing? Near the scalp area, you are taking few punches of the skin.
Correct.
Then what you are doing, you're mincing it, nothing else. You chop until and unless it becomes an homogeneous.
Solution.
You just add in saline and you inject. Theoretically, what he was saying, the blood which you are purifying, it will be or when we do liposuction, you centrifuge and blah blah, you separate the stem cells. There will be definitely some stem cells. So there will be some focal response will be there. Some or may not be, like in your case. I will say, being a scientific person, you should not use it.
And
Like
they
the ultra pure blood.
Like
What is
they-
the fun?
they
You do in
advocate
GFC, why
only
to
the-
purchase that much of machine?
So I've been using Regenera for quite some time. I have it. It's not great. Frankly speaking, it's not great. Not great means something, yes, like something, but like therapy, but the cost is not justified.
Yeah, it's not
Absolutely.
justifying.
It's absolutely not justified. Yeah,
Exactly.
Exactly that particular patient, though we have the machine, we have everything, but still. So we are doing it only for the people who ask for it with all the writers and we can do it at your financial risk.
So day 0.
Day 0 and they will have
more growth potential, definitely.
And the number of exosomes are a lot because these are
True.
cultures.
Yeah.
10 billion is a lot. We have to test how much that machine is. It would be much less. These are surgical, easier to do, and plus no new follicle formation. Nothing as of now can cause new follicle.
Let me go to one step ahead. So what?
When you talk about stem cells and regeneration, then that is what you think.
So we have actually injected stem cells on the scan. No exosome, actual cultured stem cells. No new follicular regeneration. It's all normalization of the tissue.
We'll move on to demonstration.
Yeah, right.
That's great. Hi, yeah, please, yeah, go ahead and clean what Hello, hello. So you must have an informed consent, photograph, all documentation should be there. And then after topical application, we'll clean her face, use microneedling and exosomes. Let me show you the skin one. See, you must be doing microneedling at your clinic. You use betadine always? Why normal saline? Use spirit, S again, spirit, betadine again, spirit. Yeah. Normal saline by pouring, the edge of the bottle may not be clean. Again you are putting some bacteria. So why to use normal saline? Because it's very difficult to have either you should have entirely a sterile tray and someone else pours on a sterile dish, then I hope you are not doing, you are directly putting this thing. No? Then what is the fun of using normal saline? You are again recontaminating it. See, and in general I tell you, spirit is sufficient to take care 99% of the bacterial load which is present on the skin. It doesn't mean that you should not follow the ENT tips. See, now you see I am not following here. I wear a sterile gloves but I am holding the single step. But now what the principle of ENT is aseptic, not touch technique. There will be some key areas which you will touch or hold confidently, and there will be key areas which should not touch. Clear? So like I have touched this thing. It's cleaning, but definitely I will be doing cleaning. So let me. So this is a skin rejuvenation kit. It will be mentioned skin here. This contains 5 billion of exosomes. Clear? Skin. So we have lyophilized particles. If you see, can you see the whitish, yellowish powder is there? Maybe on the walls or yeah, it's there. Then we have a reconstituent fluid. So what we have to do? Can I have a 10 cc syringe or 5 cc?
Distilled water or saline?
They have water and other things are expensive, like ascorbic acid is there. The details only the manufacturer. There are exosomes, I tell you, in the market which say you have to reconstitute with hyaluronic acid. I have one question, why to use an hyaluronic acid? Because then I don't know my molecule is working or hyaluronic acid is working, because I am already injecting intradermally.
You are mixing boosters and exosomes. So you are getting additional benefit of that.
But that will be too low dose, you know what amount of hyaluronic acid have to be injected into the skin.
Nowadays threads are also infused with HA.
Yeah. See, now again I'll tell you the key area. So I opened it, but actually I touched. I will clean it. we have an alcohol swab.
And so they say that once you apply spirit, again you have to wait.
Yeah, to get it right.
Reduce the
Sure.
efficacy.
So similarly with the needle, you know, you can hold everywhere. You can hold the hub of the needle, but you should not touch the needle. The same principles which we are using while doing injectables. The same thing. So now I want to show you one thing. See, if I am inserting my needle and then I will withdraw completely. So now again what I'll do, I'll take my exosomes and inject the diluent into the exosome particles.
How much is the diamond?
5 This is what I will see. I am pressing but it's not going. Because there is a positive pressure is there. There is a nitrogen is there. This nitrogen is necessary so that anything from outside should not go. So there is a positive pressure inside the wire. This is what I want to show. So that again maintain the sterility of the exosomes. See that much amount. Now just shake gently and see if any of the particle is there on the walls or not, so that it mixes properly. And I can see nothing is there. It's a crystal clear. So in general, you require 2.5 ml to complete the face. Since I will be doing her neck also, so I will be utilizing her 5 ml entire.
But sir, in how many days you have to use this?
Yeah, very good question. Reconstitution should be used within 7 days. After that, the stability or the chances of infections get more. The more problems with the stability of the exosomes. No, not refrigerated. You just keep it at the 4-degree temperature, not in the deep freezer compartment. Decrease. After 7 days. Till 7 days. Yeah.
But ideally better to open and finish.
And finish it. Line up 2 patients. There is no dearth of patients. There is a dearth in the thought process of yours. I always believe. I always believe whoever is present in this room, all are my patients. I can do n number of treatments on everyone. So this is how you have to see. Why to waste? So let us clean now. The Himanshi I am cleaning. This is a spirit. You may feel a bit of stingy smell. I inject exosomes in acne scars patients. For those who are coming for rejuvenation, unless and until there is no specific indication, I do only micro. But on scalp, I do both.
Injecting is painful or
That's why topical cream is there, no?
for the scalp?
हाँ?
Scalp में when you're injecting it is painful.
PRP जब करते हो क्या होता है बताइए, पेनफुल होता है या पेनलेस होता है?
PRP का solution हम लोग ज़्यादा लेते हैं
हाँ.
painful. But this with
PRP का सॉल्यूशन पेनफुल नहीं है.
जो solution हम लोग ज़्यादा है थोड़ा सा वो होता है.
See, all injections are painful. You tell me one injection which is painless on the skin.
Distilled water.
You weren't asking for the grade. The grade depends upon another subjective and objective thing. My pain tolerance is high. I never take local while injecting. No topicals. I do boosters. These things. Sabka pain tolerability is different. So pain, then there is a very big subjective issue is there now. So pain will be there, my dear.
Understood.
Have
What
you
he's
tried-
trying to convey is
Have you tried Botox with sterile water?
Nah, that I say, that is more painful because of the acidic nature.
very painful. Accidentally my sister.
This is neutral. So ideally, if you are injecting any acidic thing, it will be less pain.
So just repeat what you said.
I'm saying कि, sterile water or a normal saline, even the normal saline is more painful than the sterile water.
So, does
In general, I am saying.
then
In
you
botox,
with normal saline,
it works well.
it works very well. With steroid, it's
Botox
very
may be
painful.
different.
Very, very good.
For Botox, I am saying.
What
For
are
Botox.
What is trying to say? Any kind of injection for that matter is painful. Maybe steroid. But in Botox, this distilled water causes a lot of
Very pain.
Very good.
maybe not.
Bacterial swelling.
So I am transferring into the insulin syringe so as to control.
So this is fine to transfer.
Transfer.
Worried about the
Just follow. So where is my micro-little device? Oh yeah, same. Yeah. I use 32. So you all must be having your own micro-needle device.
So somewhere in the international conferences we saw that there was another where there are 4 needles coming out. When you're injecting, suppose you put so.
Yeah, there is a device here now. You can hold the thing, you step.
That.
No, yeah.
There are multiple
Channel
needles
through
coming
the
out.
syringe, na? You attach it with the syringe.
Ah, yeah, that is there. There's a PRP delivery device is there. Yeah,
Delivery
PRP delivery
So
device
how's
is
your
there.
experience with
I haven't used it. See, all these are fancy things. But they say what the principle is then, the 4 prick you are doing in
Yeah.
for 1 pin.
One point, yeah.
See, the same thing is there na, if you do a rapid movement of micro needles, then what happens? You are making the brain confused. See, from the right eyebrow till the sensation is traveling through anterior spinal thalamic tract to the cortex, sensory cortex, you are shifting. So there will be competition. So if you do fast, the pain sensation will
You
be
can tap on the other side and
Yeah, there are a lot of ways.
Vibrators, stress balls. Better than
One. So Himanshi, I'm just going to start. Just do let me know if you feel something. Just have a one, yeah. And I usually is sufficient. Just keep your eyes closed. 1 mm. Is it okay, Himanshi? Yeah, definitely you can go. But here my intention is not to inject in her case since she is not having any scars. What I need is a glow, improvement, rejuvenation. This is what my intention is to have. and there's a bit of hyperpigmentation on the forehead, you can see. And maybe sun damage. Is it okay? That's good. Are you able to feel anything? That's yeah. See now, this
inject a little bit also.
considering micro needling, our job is just to create micro channels and don't leave any area. There, no doubt what we are saying, there will be wastage. So if you inject, I think, then there is a less wastage. But then there will be downtime. Clear? So both the things we have to judge. Yeah, definitely everything. Exosomes can do everything. Pigment, melasma. Only thing is that for melasma you have to be a bit aggressive. So in melasma what I do 2 weekly sessions instead of a 4 weekly session. In rest I follow monthly 4-week session.
But 2 to 3 weeks that can be kept for melasma.
Melasma 2 weeks.
Same exosome is used for degradation.
Same as I told you, it's day 01, so it's having a potential to take care of each and every cell.
This can be spaced along with relaxing injections.
No need, because what I have seen even with the monotherapy means no other topical thing. Only with this thing there was improvement.
Only with this.
Yeah.
Sir, because
Like-
microneedling also has its own
Like there are case reports now, you must have seen. Another insulin syringe, please load so that we can save time. Are you okay?
Sir, you're doing for melasma, you do only for the melasma.
Melasma part of me, yeah. Since I have opened a wide, I have to go on entire age also. And you? For the treatment is just see her develop. Do let me know, Himanshi, is it okay or is more painful on the right side? Fine. That's great.
So can you inject this also?
Yeah, I do inject, but in her case, I'm not going to inject. I do inject for a very creepy skin or acne scars, too much of open pores. There I inject. Otherwise, I do only topical. In melasma, topical.
You change the needle of the insulin.
Pardon?
You change the needle of the insulin.
See, insulin syringe is a disposable thing. You can't change this.
So you said 32 number.
No, that I asked, supposing if you don't want to transfer your insulin syringe.
Then you can directly use the.
They said you can use 32.
Is available. Even 34 is available.
Here we don't want microblading for
Micro? No. Here my question. Just see, with micro needling, in her case with exosome, there is no need to go for a bleeding spot because it is this molecule is going to do the wonders. Our job is just to create. See, even if you apply, as I said in the slide, even if you apply topically and if you don't do micro, still it's going to work. But there will be a lot of wastage of the product. Yes. So micro creating a micro channels into the skin, there I am ensuring yes, less wastage of product is there.
Ultimately, if exocytosis is usually available, it is in the
basal layer, melanocyte. If the exosomes is entered in your earlier keratinocyte, like you want to stop the production, like it has to be.
Then their deeper penetration is better.
It will go. See, as I told you, they will identify the 6 cells. There is a, if you, you will be knowing better pathology of the melasma than what happened.
Multiple cells, how they decide and go and.
This is the beauty of the signaling molecules.
What she's trying to ask, sir, what she's trying to ask, is
Why
there any
don't-
harm if we go a little deeper?
No harm.
So that it goes
No harm.
into the channels
If it
rather
is
than.
going and stimulating my
No harm. You can go. You
Sometimes we get satisfaction only if we go deep.
go. You can. Can I have a look? In acne scars, I harm. In acne scar, I do.
Fibro was there, scarring.
Too much
Like surgeon, we also love to see blood. Like surgeons, we also love to see blood.
That you must be doing now with derma rollers and those things. See, Acha, still you people do derma roller or derma roller is in oblivion. I want to know.
Patients want something fancy with dancing derma roller.
But derma roller was there in 2006-7, I say.
They done with it and they are like curry अभी कुछ नया कर
आप तो फिर नया मशीन खरीद दो.
Face, all these things are trying to scan
They can always.
Home remedy also there.
That is their home remedy.
Okay. See, I'm saying clinically you must have stopped using derma roller, na? It's now a home care product.
Which
Yeah.
derma roller they want to use.
Yeah,
That is
true.
their setup. That is
Is it okay on the neck? Huh? EFT means? Yeah, the Korean soil is there. It's already there. थोड़ा सा और बचा है. No, this is our Indian. Yeah. See, the beauty of Advancexo, I'll tell you the history. They are into stem cells for last 13 years. For last 2 years, but they were into exosome, but not for the clinical use. They were used for targeted chemotherapy, the drug trials, all those things were there.
So in this syringe, when we tuberculosis, we can change the needle.
Needle, yeah, 32.
And then we can inject.
I'm not going to inject, don't worry.
I know that.
So what is the depth of depth?
At present, I'm doing 1.5. Initially, I started with 1. Insulin is 30.
What is 30?
Yeah, results is some improvement we can see maybe after a session also, some those things. But it's better for what indication you are doing accordingly. For? Like you can do 1 week, I'll say. Depending upon the condition of the skin. Like her, maybe 1 session is okay. If the damage is more, then you have to do more sessions. We say around 4 sessions is sufficient. 3 to 4 sessions. Yeah. Yeah, injections. I do microneedling as well as injections. Yeah. For acne scars, no. Acne scars, 4-week care. And for melasma, I do 2 weeks.
this liquid can be applied over the eyelid.
Yeah, everywhere. In the finger. 4-week gap is good. always with a knife. You can remove so many things. You can use water, you can use plasma pen, you can use CO2 laser, you can use RF, everything. You can just shave.
You can do this at home.
Yeah, definitely to expedite the process. Any ulcer?
Patient is having
See, I have started using, but it's too early to make any inference. I'm using on keloids also. So let's see. Any new molecule comes or we clinicians to try or at least on the keloid and hepatitis. Because it's so common. And nothing but
Contraindication for
yeah, I'm doing both also. Definitely no doubt. I do both. I mix it inner cord and some part I keep, which I dilute it with the normal saline. I inject microbotox all around the margins as well as in the keloid. Yeah, you can. Yeah, definitely. Immediately, yes. Okay. So for at least 6 hours, very difficult to say. In her case, you may, because her skin is already flawless. So for first 6 hours, you should not put water in the skin. You can do manually 0.25. See, for 6 hours, no water application, no other things, but you can apply once this get dried up, you can apply any hyaluronic acid cream or a gel, serum, sunscreen. And from night, after 6 to 8 hours, after 6 hours I'll say for my she can use her night rate. We are done. What? Yeah. But let the serum which you have applied and let it get dried up. Ideally, we should not. Just. Sunscreen, yeah. But let it get absorbed. Anything which is not hard.
Not only with this, most of the time that is
our
challenge that we want to tell them because you are saying we are not
it's better ideally after microneedling. What advice do you give after microneedling? Teach us when you are doing a vampire facial. When from how much time? Suppose I have done a vampire facial. And today suppose this is a vampire facial. What is the instructions?
There was a 5 cc syringe also. 5 cc.
The surgical mask you are saying? You think I have learned it today? That's great, really. So I'm giving you a mask. There was a surgical mask, no? More on the right side. In your 5 cc. Once this get dried up, just to
Protest for 5 cc. That's xylitol. We have seen it with micro needling because it's a hair loss. The scalp base will be injecting exosomes. So just a rider, the company doesn't promote injecting because there are some legality issues with injecting, but we can inject. The only difference is that we will be diluting it with saline rather than the diluent given.
Why, sir? Why? Because the diluent has vitamin C. That's more for skin.
Also, sir, which one is better for hair loss? Injectable or microneedling is also good enough?
Hello. So injectable is always better because you are depositing the exosomes, the material at the right depth. So it should not be very deep. It's like intradermal injections. Microneedling is okay. Even just rubbing is also okay, but the absorption is too less. And when we are microneedling, then also the penetration is not to the depth that we want. So just like PRP, I'll be injecting it on the scalp. Now, why I'm using a different diluent is because the diluent provided with the kit has distilled water. Right? Distilled water itself is a very painful. So, like if we put botulinum toxin, we do not mix with distilled water. We dilute with saline because it's less painful. So that's why we are going to dilute this with saline, normal saline, and it does not destroy the efficacy of exosomes. I have asked with the company, and then the question is, then why they do not give saline? Why distilled water? Because of some legality things. But we as doctors, we are not bound with it. The manufacturers are bound with it, so we can inject.
They usually provide distilled water with everything as a reconstituent.
As a reconstituent.
They always provide distilled water.
So their distilled water is with vitamin C.
This
No,
one.
with Botox, with every,
Yeah.
with all the
This one has
medications.
vitamin C. L-ascorbic acid.
It is distilled water with vitamin C.
With vitamin C.
So it's stable.
Stable, reasonably stable. But, okay, so now apart from the injecting, so probably this would be something. How do you inject anesthesia? How do you load lidocaine, doctor?
I prefer mixing it with saline because the pain reduces.
And how do you load it in the needle?
Pull it and just
Aspirated, correct. So when we do that, let's say if I would have used this directly here and aspirated, so there are two things. The needle gets blunt and it becomes very, very painful.
Yes.
So being an aesthetic procedure, we have to be considerate about the pain. So this is what is the better way. You load it in a whatever 3cc or 5cc syringe and then individually. And same thing is with any toxin, Botox or anything. This is a better way of loading your Botox. The injections become very less painful because mostly when you are injecting anything, the pain is more of the needle prick rather than the material being injected itself. This is xylitol. It's random. We are on 0.8. I'll be using around 4 ml to anesthetize the scalp.
So you never do a test tube?
Always do a test tubes. Being a it's not very effective. So we have applied logs here. It's not very effective. So even when we do PRP or injectable, prefer ring blocks. The treatment becomes very comfortable.
You need a swab.
Pause.
Hardik, watch.
Pause. how we are doing it. So I'll not be injecting everything. I'll be doing micro droplets, so that both act as a test dose as well, and it blunts the pain of the main anesthesia.
So it's like 1 unit?
1 unit for this.
How much is needed for the whole scalp, sir?
So around 4 ml is okay for the frontal ring block, and if we want to do a vertex ring block also, then another 3 ml approximately. After 4-5 pricks, we change the needle. So I changed this needle because it was getting blunt. So I'll be using that for the rest of the anesthesia once the initial numbing is done. So that's initial numbing. Now we wait for 2 minutes. So now the benefit is that now when we will be injecting our main anesthesia, higher volume, this scalp is already numb. So the overall pain was much lesser, and also the test dose is done. Because let's say nobody have you ever seen any anaphylaxis yet with lignocaine, anyone? So the last case reported was probably 30-40 years back. So it's hardly, but as a protocol we do it. So now this thing has served both the purposes, as a test dose also and the initial numbing also.
So we usually ask the patient if he has undergone
A previous transplant. Yeah, but again, from medical legal point of view, it's always better to document this as a test dose.
Without adding.
No, I prefer with it. Here I don't really have it. We prefer with it. Faster action. Slightly longer. But otherwise, for this process doesn't matter, because anyways in 15-20 minutes they are going to finish it. Always. So whenever we're injecting exosomes, PRP, GFC, always I prefer a regrowth. Unless the patient has done it 7-8 times already, reports I have a good tolerance now, then without it.
So what about nerve blocks?
Nerve block is great, works very well, but you still have to give a ring block. And nerve block becomes a bit frightening for the patient, being too close to the eye. They are scared. So in PRP, because it's a 15-20 minute procedure, exosomes, I don't prefer to use a ring block. In hair transplants, I always use a ring block.
Ma'am, ये कैमरे में आप आ रहे हैं, आप प्लीज कैन कम दिस साइड रिकॉर्डिंग दिस प्रोग्राम the bigger space आप इसका काट
So it's done. You just wait for 2 minutes.
Get the scalp cleansed.
Sorry?
Cleansing is scalp.
Cleansing is done, already done. So, with spirit rub, alcohol rub.
Just this bit.
Just the normal alcohol rub. So whatever we can use, cadmium, normal isopropyl alcohol. So again, in the initial droplets, pricking was not mandatory because we were injecting very less volume. But when we injected the main anesthesia, aspiration is very important. So I'm sure all of us aspirate because the amount of, so when we are injecting filler, okay, you know, the aspiration hardly ever gets us blood. But when we're injecting on the scalp, being a very vascular area, you would not imagine when we do hair transplants, in almost every patient we aspirate with insulin needle. So it's very important to aspirate anesthesia, I mean when we are injecting anesthesia. After that, after the boluses are done, so we just have to press it, mix it so that there are no leftover areas. And in 2 minutes, he'll start feeling the numbness. थोड़ा भारी भारी सा लगेगा प्रमोद जी, ठीक है? So it took us what, less than 3 ml. I'll just inject a bit more on the corners. I've not injected on the vertex. So not yet. Because again we have more vein there, so we are going to inject it till here. So this ring block will give us a good feel. So if we are injecting on the vertex, we should give anesthesia there. Yeah, again we take. So again, see here you can still see, but on a hairy area it's very difficult to see where you give that initial drop. So always good to mark the area and then do that one drop. The scalp is prepared now. Okay. Now I just need some help. So the difference between the hair kit and the skin kit with this particular brand is that hair kit has 10 billion exosomes. 10 billion. So we'll dilute it with 5 ml. Twice. So I take the powder now, that's the exosome, and that is the, so it will be like a hands-on also. So this is the diluent, we don't want to use this diluent. Good. Open. So this is not, does not have the back. And we'll do 2.5. It's okay, it's better to use another one, but it's fine because it's direct. So do we want to do hands-on?
Yes.
So let's start with preparation. So we need a volunteer to open up the insulin needles. We have insulin needles here. Take out the plunger and load 5 syringes. This is stable problem. Too long is not needed. Just gentle rolling, take up down. It's like a hands-on because they are going to do it with clinical practices.
I think let them use it.
It should be very close.
Throughout this. So now we'll take another 2.5 and whoever wants to fill it up and do that. So we are at 5 mm, 2.5 to 2.5. It's a 2.5 cc syringe. Okay, let's just start with 2.5. Let's fill 3 syringes do and then we'll refill. Then we'll refill them. Let's fill it till 30 units. 30 units. Slowly. Let's slowly fill that. So that because we have some space to move there. The rest of the thing is completely whoever wants to do a hands-on can. So gloves are there. The anesthesia is now. So this is ready. पेन होता है तो बताओ ठीक है ये सुई चुभती है हाँ सुई चुभ रही है नहीं चुभ रही है हल्का हल्का चुभ रहा है you just wait for 2 minutes more for the exercise. Yes, wait. Injection feel हुआ आपको? So now, so when we are injecting anything for hair, it's a good practice to do it intradermal rather than subcutaneous. Normally, I also used to do the same mistake. Used to inject it subcutaneous because that's where it's easier to inject. Right? So try it like an intradermal injection so that we raise a small flare and multiple pricks. And that's another benefit of anesthetizing, that we can go for multiple pricks rather than boluses, very big boluses. Light है क्या? torch है? So the scalp has already been cleaned nicely. Try to go. Huh? Yeah, that's maybe around 3 units. Pain हो रहा है? कितना हो रहा है? थोड़ा सा? That's why with ADR is always preferred. The onset is very quick. Ignokin with ADR. So, Manish had.
What do you see right now? Topical.
So we have already. Topical is like easy, but we are doing multiple tricks. If the patient is able to take this, it becomes comfortable. So, so per brick we are using around 3 to 4 units per brick.
It's like PRP.
Like yeah.
5 syringes, 30 ml each.
And it is advised to use around 5. So the amount of exosome to be used depends on grade of alopecia.
So amount the area that you are going to inject it on. So when we have anesthetized, when the patient has come, I think it's good to inject to the entire crown, full crown, and we are using one full vial, that is 10 billion exosomes. And depending on the volume that we want to use, we can dilute with that much volume of diluent. We have chosen around 5 ml this time, because usually 5 to 6 ml should be fine.
And conventional therapy is minoxidil and asteroid may be continued.
Of course. As again, as monotherapy, this becomes too less. So in the meantime, the next batch can load more syringes. 2.5 ml. So we have already diluted the exosome.
Experience with alopecia area?
No, not yet. With PRP experience, I did not find it to be effective. No, it's not. Not the just take it. You can use. Use multiple pictures, small, let's cover this entire area. So that's why see when we are injecting it subcutaneously, it's easier to inject because there is very less resistance. This is nice, but this is it's going through the right depth. Near the hair. So now the patient is comfortable.
So when you put this inside, there's air.
So take it, tap.
ब्लॉक लगाया था उसने?
ब्लॉक लगाया
थोड़ा है
अब ठीक है ना?
Thank you.
Okay, next.
So roughly, if you're filling 30.
So with 5 ml we are able to fill what, 7 syringes approximately? These are exosomes, right?
Yes, sir. Yes.
And that's also exosome. This one. So we will not mix it with blocks. These are all exosomes. We can put it. So
How
we
do
have
you give it directly or at an angle of
angle 45 to 60 degree angle, so that's not going subcu.
the whole bevel? This should go inside.
Depending on the angle that you are using. So always you have to take out the air completely. This area.
How much to deposit in one?
So we are doing this time 3 units per day. So what if exosomes are injected intravascular? Or what if PRP is injected intravascular? We don't hardly anybody of aspirate while we're injecting. So what if PRP goes intravascular? It has a very high coagulation profile. So what if it goes intravascular? PRP is actually riskier than fillers when it comes to intravascular injections. So when injecting PRP, so have you seen PRP getting coagulated while we are preparing it? It's so common. So PRP has high coagulation profile. So intravascular, not many people talk about it, but intravascular can be disastrous with PRP. So that is why staying intradermal, actually seeing the bleb getting formed so that you know that it is not going intravascular and into the tissue, and not using a lot of volume, like 0.3 cc in one bolus, it's not right. Very small amount. So either you aspirate before every prick with 3-4 units maximum per site. Okay?
PRP is patient's own blood, though the concentration 10 lakhs.
Coagulation. If we have injected in a vessel,
3 units.
so if you are using 3 units, it's good, it's fine. But that's why we should not use boluses, big boluses, and try to be like superficial.
Because I was thinking its own blood, whatever if it goes in all.
That's what we think.
With arthritis and all, we have seen that coagulation happening in the syringe itself.
The syringe, exactly.
And the syringe itself, and the company still asks us to push little bit. Is it risky then?
It's risky. So coagulated thing going in a like a intravascular, it can be disastrous. Embolism.
It has been reported?
I don't think it has been reported.
There is any study on it?
I don't think. It's a thought.
GFC 2 cases of anaphylaxis in the conference. So I
Yeah,
was pretty sad to hear that.
This conference.
Yes.
Yeah.
No.
This conference
We
only,
heard
in
somebody
the
saying
morning,
it
like
didn't
yesterday
happen.
morning,
That didn't happen.
But they just
They
give
said
their
Pune one
experience.
doctor, Pune
Yes.
one plastic surgeon, and one another doctor, I don't know. They were all the big wigs of
Scary, no?
Very scary.
And we are using it left, right, and center.
Anaphylaxis.
So why so many patients had disease? Chakkar aa rahe hain, thand lag rahi hai, eyesight aa rahi hai. No.
So yeah,
How
with
much unit? 1 unit?
3 units.
3 units.
Per break, 3 units.
One like 3
So yeah, I think with PRP, intravascular should be avoided. It's not a very simple
And
thing.
exosomes.
Even with anything, even with exosomes, but at least here there is no risk of coagulation there. But that's not my question. What if it gets intravascular? I don't know. If it happens intravascular, what will happen? So stem cells are being injected IV a lot, which is fine. So exosome should also be fine, but I don't know really.
You're saying I will get dilute simply, I feel.
That's what I don't think with exosome, but PRP, I think PRP में coagulability is a thing. So you just have to be a bit careful with PRP.
That way, you're saying
PRP is with anticoagulants, no, like this arthritis, without any anticoagulants. And I think it's good.
Nothing goes into
because you don't even know how
देखो चक्कर सा तो नहीं लग रहा?
viral
Can you see if there a liver? Is the chair coming up, or head is getting slanted or not? कुछ है liver है? No. Alright. ठीक है. Fine. Fine. So, doctor, along the hairline. So along the hairline. So just prick along the hairline. Hair will be more, along the hairline.
amazing session, sir. Thank you so much for your time. And I also request Dr. Gaurang Krishna. Please come on stage.
Thank you, ma'am. Second, next again.
Yes. We'll do a E, exosomes.
Dada, stay. Okay.
Yeah. Ready? Thank you.